travel isn't just about destinations. It's about the people you meet, the cultures you immerse yourself in, the stories you carry home. I'm Relebogile Mabocha, and on my travel feature, I take you on a journey beyond the guidebook. Each week, I connect with fellow travelers, insiders, and storytellers to bring you the heart of every place. Whether it's a hidden gem right here in South Africa or a dream destination abroad. Join me as we travel through conversations, memories, and inspiration. Listen wherever you get your podcasts.
702 Health and Wellness.
22 before 12, time for our health and wellness feature. Today, as I've said throughout this morning, is that we're talking about antidepressants. What should you know about antidepressants? I indicated earlier that I saw data that revealed that over 1 million South Africans were on antidepressants. This is a few years back. I'm sure the numbers have changed now. But before taking them, it's obviously crucial to be aware of the potential side effects, the time it takes for them to work, and the importance of consistent medication use, and also just constant communication with your doctor. Yes, they can be effective for depression, but also some experts tell us they may take some time, or even several weeks or even months to reach their full therapeutic effect. So it's important to have that ongoing consultation with your doctor, that potential interaction even with other medications or substances like alcohol also becomes an important consideration to make when you want to look at the effectiveness of antidepressants. But we've got someone who knows much better than I on this, who's going to guide us through this conversation. And I want to hear from you as well. Do you take antidepressants? Are you cautious about how you take them? How have they benefited you? What's been your experience? Give us a call or send us a WhatsApp voice note. Dr. Alicia Porter is a psychiatrist guiding us through this conversation. Dr. Porter, thank you for your time. Good morning.
Hi, Clementine. A very, very important conversation. So I'm really happy to be here this afternoon.
Yeah, thank you for the time. What exactly are antidepressants? Let's start there. And how do they work in the body?
Okay, so, antidepressants are a group of medications, and like you said in your intro, they may not only be used for depression, but I'm going to talk about antidepressants for depression. So basically, they are a group of medications, and what they really aim to do is to help to improve our mood, help to improve our sleep, our appetite, and even our energy levels in people who are experiencing, be it depression or anxiety. So what this group of medications is wanting to do is to balance the chemicals in our brain, because when we have depression, it's not just about the mood. All of these other things become sort of disturbed. And so we need to restore the balance, and these medications help to restore the balance. And they work on specific chemicals, or what we call neurotransmitters. So it would be serotonin, which helps with, sleep, appetite. It works on, noradrenaline and also dopamine. So those are the three major sort of chemicals that become unbalanced, or there's not enough, there may be a deficiency, which is very simply put. Because these things actually affect the way we feel and the way we think, because our brain is made up of lots of circuitry, and, it's a whole production center that kind of powers our body. And we need these chemicals, in order to function. And when there's depression, there's not enough of these to function, or the balance is not okay. And so these medications are there to bring or help bring the balance. That's what they should be doing from a physiological point of view.
Okay. So when does a health professional decide to prescribe antidepressants for depression? So at what point does that become the consideration?
So, it is, you do need to have, an assessment, but, just sort of very broadly, the difference between like somebody who is depressed now and then and somebody who has a major depressive disorder has got to do with how much whatever's happening is interfering with your day-to-day functioning. So when there is what we call functional impairment, so if you're not showing up in the way you used to, if you're not functioning the way you used to at work, if you're not sleeping well, if you're not eating well, if you don't have as much energy, that shows that there is, functional impairment. And so it would then put the depression at a more moderate to severe. So if the depression is more moderate to severe, if you've tried lifestyle changes, if you've tried therapy on its own and it hasn't been helpful, then we should consider the use of medication at that point. But the biggest indicator is when you're not showing up like you used to. Because we can all have, for example, an amount of anxiety, but that doesn't mean we have an anxiety disorder. But when it is then limiting us, or, we're not doing the things that we usually do, then we need to start thinking about medication.
Are there several types of antidepressants, or there's just one? And what are those differences?
So there's multiple types of there's different classes of antidepressants. Now, like I mentioned in the beginning, we're looking at serotonin, we're looking at adrenaline, we're looking at dopamine. So basically, you can get antidepressants that may contain only serotonin, others that will contain a combination of serotonin and noradrenaline, others that may get a combination of serotonin, like noradrenaline and dopamine. And it does also depend on, because depression looks different in different people. So it's not a one-size-fits-all, So when I see a patient and they've got depression with, more anxiety, my choice is different based on, what I'm wanting to particularly target. If they've just got a very low mood, no energy, no motivation, then I'm thinking it's a different neurotransmitter or a different chemical that may be more pronounced. So, I kind of like to think about it as we need to synchronize it according to, what does the depression look like in this person? Which may be different. And so not all antidepressants work on all of the neurotransmitters or some of them. And we should be thinking in that way. And that's often one of the reasons why you'll get, people not tolerating certain types over another type. So it's not just, here's a bag, here's all these types, let's just pick one, because it is about what does it look like in this person in terms of how effective this is going to be.
And in as far as side effects are concerned, what are some of the common ones?
So, the thing with the side effects is that they are usually short-lived. So if you're going to get side effects from the antidepressants, it's usually in the first sort of month of treatment. Mainly by week 2, at the end of the second week, we should see a resolution of them. So some of the common side effects would be things like your GI, your tummy complaints. So you may get nausea, you may get some, change in your bowel habits, some constipation, some stomach pains, but those actually settle quite quickly. You also may get things like where it might make you sleep too much, or it may interfere with, with your sleep. There is also some classes of the antidepressants that may, some people describe things like numbing. That may be a particular type of antidepressant. And again, if the depression, depending on what it looks like, in you would then kind of inform my choice of antidepressants. And then also, for adults, some of the types can also cause sexual dysfunction. And so these are the things that we need to be mindful of. But they are overall generally well tolerated. But it does go back to, what is it that we're treating? What does it look like in this particular person. And so these are the possible choices. And obviously, there are individuals who may have difficulties in terms of tolerating. So we kind of do need to, wait for at least a month before we make a call in terms of, actually this is not working, because, the antidepressants don't work immediately. And so they do take time to settle, and then you've got to look at kind of the effects of doses, which is very individualized for the different, for different people. So, I don't think it's as kind of simple as, okay, I'm going to take it and then I should just feel better immediately. I often tell, my clients, it's not like a headache tablet, where you take it and, because remember, there's been a complete upset of your, the way your systems are working, and we need to first reset it before we can get things working.
Got it. I want to take some calls now and WhatsApp's 011-883-0702 is the number to dial. The WhatsApp line is 072-702-1702. Have you tried antidepressants? How have they treated you? Are you cautious about how you take them? Please share your experiences with us about antidepressants. Cindy, let's start with you in Joburg. Good morning.
Good morning. Good morning, Clement.
Hi, Ma'am Cindy. Go ahead.
I just wanted to find out from the doctor. I've been on antidepressants for quite some time. It's intermittent, but these days, because I've had like major depression, and I've been on antidepressants. I'm 72. I'm 73 years old. I've been on antidepressants. I think now continuously. It's now the third year that I've been on a daily basis. So I'm just wanted to know, can they be taken as a chronic medication?
Okay. Cindy?
Does that happen? Because the minute I'm, even when I'm on antidepressant, and when something huge happens, I cannot cope. I cannot cope. So I just trying to find out with my age, but I don't have. I used to have a side effect, and then they changed until now. I think I'm on medication that goes well with me. So I just want to find out, because I'm also on other chronic medications.
Okay. Ma'am Cindy, thank you so much for your call in Joburg. Yeah. Dr. Porter?
Yeah, there is, in terms of how long, you need to take medication, or I think the question was, can it be chronic? And yes, there are instances where if there's been recurrent, depressive episodes where, you may need to take them chronically. But I always advise that, this is something that constantly needs to be checked back with your healthcare professional, and constantly, if changes need to be made, or, if it is chronic, it does need to be, monitored, and those kind of things. But the short answer is, there is, although we don't start out by saying, it's going to be chronic, we should initially at least treat for up to a year after a first episode. But, like Mom Cindy says, that it's been, her age, and it's been recurrent, and all of those things, that it can, in some people it can be chronic usage, but it doesn't start out like that. It's, again, those individual factors in different people that would determine, because again, we also have to look at whether there's been like a family history, because that, is an increased genetic vulnerability. What else is happening? Are there other illnesses, like, for example, hypertension, diabetes? And we know that there's a higher chance of depression just with the treatment of, or the kind of consequences of, these conditions. The medication can also kind of cause or worsen depression. So there's multiple factors, but I think the short answer is that if it is needed and there's been recurrence of episodes and there's other things happening, there are people who would need to take antidepressants.
Okay, here's the voice note.
Hi, Clement. About antidepressants, what are the side effects if you take antidepressants, tab medication, and how long should you be taking it? Also, another thing, what can you supplement, what foods can you rather eat opposed to taking antidepressants medication? Because we know medication and tablets all have side effects.
All right, thank you for that. Yeah, Dr. Porter, you already touched on, the side effects. Maybe you can emphasize more on the food you eat in the second part of the question.
So, one, there is a class of antidepressants where, it did interact with certain types of food, but that particular class of antidepressants is not commonly used, it's not as readily available. And because there are other options, we don't use them like previously. So it was things like cheese and chocolate that would interfere with the actual, how the medication was processed. But, having said that, there's nothing that sort of will replace a balanced diet. And so we do need to make lifestyle changes with regards to diet, but it does need to be a balanced diet. There is often, food fads where it should be this type of diet or that type of diet. But the evidence is not really conclusive in terms of that it is considered a treatment for depression. It's great as a supplement for, as supplementation for the antidepressant. So if you're taking medication because you've got like a moderate or severe depression and you use lifestyle changes and you focus on diet, that is more helpful than kind of deciding that it's either this or that. I think it really is more about balance.
Yeah. Kamohelo, you're in Soweto. Hi.
Hi, Clement and Doctor. I wanted to contribute to the conversation today. I was recently diagnosed of a gynecological condition, and amongst other issues, I had premature menopausal issues. And because each medical case, it's different. I was not being able to be put on hormonal medication. And then I was prescribed antidepressant, which I took for a month to correct what I was going through. And I was very worried because of the stigma that is associated with antidepressants and the implications on financial institutions like insurance companies. So I was prescribed for them for a month, and then it corrected the situation, and now they have changed me to something. So it's quite interesting. I just thought that I should share and maybe let the doctor say about that we obviously think antidepressants are only for depression. Meanwhile, they can be used for other conditions
as well. Yeah, no, I'm glad. And Dr. Porter touched a bit on that as well. Thank you so much, Kamorelo, for raising that with us. And Dr. Alicia Porter, a psychiatrist, thank you so much for also making time for us. Unfortunately, we're out of time, but I see that we still have so many questions we haven't even gotten to. So maybe we should bring you back and we do part 2 of this conversation. It's 3 minutes before 12.